Hello, everyone. Welcome to today podcast, and welcome to and thank you for joining us. Today we have a very special treat for you. Two incredible speakers, and we still have a few minutes to 12:30, and we have people join us. So let's see. Let's first of all welcome people that are already here. Jeremy, hello, welcome. Margaret, hello. We have Peter, hello. We have Shane, hello, Shane. I have Tony, hello, Tony. And I have Emmanuel, hello, Emmanuel. And well, for all of you, you're already here, welcome. Tell us from where you're coming from and from which city. How's the weather over there? Here in Clearwater is now I guess around on 50, 55. Hello, Edwards. First of all, how are you?
Good morning, Danielle. Good morning, Dr. Brad, and everybody else joining us.
Exactly. So how's the weather in Miami?
Well, I'm in a room right now, but my computer says 73 and partly sunny, so we're
Oh
getting better.
wow. So that's good. Yeah, most probably now that it's about 12:30, temperature went up. So let's see. We have more people coming. So welcome everybody. Yeah, today we're going to talk about and about the peptides and longevity boom. Why every clinical needs a cellular renovation protocol in 2026. I mean, guys, unless you are under a rock, you may have heard of the boom that is happening in the holistic wellness field related to peptides. Everybody's going crazy about peptides, and so we want to talk about that, and also we want to talk about of the longevity craze that is happening in the consumer market, and most how you as a wellness practitioners can get on the front line of this wave and be a solution provider for all this high demand that there is in the market right now. And without disrupting what you're already doing with the existing protocol and the existing technique that you're using, if you're a nutritionist and you use NRT, or if you have your med spa, or if you're a chiropractor, or if you're an acupuncturist, whatever you're doing, this protocol, the things that we're going to talk today, is going to be something that is going to help everything that is happening. So, and again, and obviously welcome also to Dr. Brad, our clinical director, that he joined us as well. Dr. Brad, how are you today?
I'm doing awesome, and I understand it's cold up north. As a northerner, I miss that,
Yes.
but I can appreciate the people in this area want warmer weather, so I'm enjoying the tempered weather.
Exactly. All right, so Edward, first question to you. So as you know, because you are in this industry a lot, so we have this 6.8 trillion wellness industry that is happening across the planet, and there is a lot of longevity boom. People that want to live longer, or extend their life, or biohacking and finding this system, that system, and so forth. Well, in your opinion, because you're in this is the industry you're on, like what is it that's driving this whole wave in based on your information, your experience?
Well, good morning, everybody, again. Uh, Basically, when I first started up with the UNS group, you guys are always talking about changing the paradigm. Well, the paradigm is shifting already. We're no longer looking at a medical field concentrating on curing symptoms or taking care of specific problems. they're looking at longevity. Well, longevity is fine, but now we need to find quality of life. And that's where you guys can still be ahead of the curve. It's not live longer. We've already figured out how to make people live longer. It's how to make them live longer with quality of life. And with products like BioCell and peptides and all these natural components that we know now work so well, we can help the patient not only have a longer life, but a better life. And we can provide that with the supplementation you do, the BioCell products, and the nutrition aspect of what you guys do. That, as you can see, in the last year, it's been trending towards what we eat. It's being focused on now. You're talking
Right.
about eggs and how the chickens are being fed and whatnot. You guys have been doing that for 10 years now. You guys are ahead of the game. And with products like BioCell Line and other ones, it helps you keep ahead of the game because you'll have the innovation of these products that have been around for decades, whereas the rest of the world is starting to catch up now.
Yeah, totally. Yeah, totally. You're totally correct on that. And definitely, all our guys is definitely already ahead of the curve. Now, let's switch to Dr. Brad from a clinical perspective. Dr. Brad, so based on statistics, like Gen Z account about 41% of the audience that are driving this sort of wave. And they don't look for specific just genetic advice, but mostly like they like to have very precision and okay, so what can I do at cellular level type of wellness and answer to that point. So how you're saying that this shift, how this affect practitioners in their local market and how our people or practitioners in general, existing clients, existing students, but also for new people that hear us for the first time, what is that they should be doing to respond to such a demand in the market?
Well, the first thing they need to do is stop talking symptoms with patients and start talking wellness and function, because function is the key. Because anytime a symptom shows up, function went the wrong way for a long period of time. And so everybody nowadays is interested in not getting the symptom in the first place. So start talking function and let people know two things are necessary. Number one is they got to stop eating junk.
Yeah.
Everybody likes their sugar, but the sugar doesn't like the body. They should take a look at the Pottinger cat book. It's just called Pottinger's Cat by Dr. Pottinger. Will explain what's going on genetically within the society in this day and age. And then get people to not only clean up their diet, but start looking at what supplements need to improve the function of their body and what function are they trying to improve in the first place. And that's where there's lots of wellness questionnaires out there, and we have a testing system that they can use. Whatever they're doing, start talking function and not symptom relief.
Very true. Very true. And that also by doing that way, they're going to talk about more wellness and handling the root cause at cellular level rather than symptoms.
That's right.
That's totally true. Edwards, going back to you, let's talk about peptides. So everyone talk about peptides, like every wellness magazine, if you go into their wellness blog, somewhere on the wellness tab, somewhere along the line, there is a blog about peptides, right? So, and we know about the GLP-1 peptides, but Human Ultracells, which is the product that is done by your company, use biologically active peptide extract. So can you explain for people, our listener, so what is the scientific difference between a synthetic peptides versus the one that is pharmaceutically graded that you use, and why this matter, why this is an important point?
First off, when you're talking about peptides, you're talking about one singular function. When you're talking about peptide extracts, you have various functions that they can do within the body. Whereas the best way to explain it for your group, you guys are very used to using the Cellular Gain products. Cellular Gain Heart has peptide for the heart. It's directed directly to help remedy any problem with the heart. With the extracts we have in the Human Ultracell, we're working at multifaceted levels, facilitating pathways and allowing communication to happen between the cells. Whereas a single peptide will go and activate one site with one specific purpose and one specific function within the cell. This is the Human Ultracell is a broader aspect of facilitator within the body at a cellular level, helping communication, also helps diminish replication errors in your synthesis of proteins and whatnot.
That's great. So therefore, like the Human Ultracells have a more broad stroke type of approach that is handle different aspect, right, to be very specific to one thing. It's just more of a
and
whole
another
body
note
type of approach.
I'd like to make more in a commercial sense is we're moving, like we said, we're moving in this direction now. There's a lot of peptides out there and there's a lot of options out there. And that's the one thing that you always have to use to distinguish the quality of the stuff we use. Not you guys vet all your vendors like a standard process and BioCell. You know what you're getting is top quality. BioCell has 70 years, 80 years behind it of manufacturing and sourcing and knowing how to do things correctly. This is a non-regulated space. The supplements and the peptides and all that. BioCell has always taken an approach to go directly through the practitioner and not go directly to the consumer because of this, because we take the extra mile to make sure what we're giving is quality products in a very diluted market.
That's great. That's exactly correct. Dr. Brett, so one of the specs on the Human Ultracell mentioned that it works to reduce DNA and RNA replication error. So more from a clinical director point of view, why is handling this replication error is going to help ultimately to handle the root cause of things that are happening at cellular level that is maybe wrong?
Well, the easiest way to answer that is just think of the errors in the RNA and DNA and the replication as a computer virus. You get that into your computer doesn't work well in certain areas, or maybe not at all. So
yeah.
handle them, and the issue is handle it before it breaks. As I always tell my students, the best time to put out a forest fire is before the fire starts in the first place.
Yeah, totally. Edwards, like another question that definitely came up is in relation to the formulations of the product, right? So there is, if you look at the different point in the listed, like there is embryonic cellular extract with energy regulating enzyme. So how this is combinations help to restore the balance in the and help the mitochondria, because that's one of the key functions of this product that is affect the mitochondrial level.
Well, the NAD component in the Human Ultracell, we know today to be a mitochondrial stimulus. It helps build energy within the cell. The mitochondria, as we all know, is the energy source for the cell. Without energy, we can't function as ourselves. We nourish ourselves and feed ourselves to get energy. Well, the NAD component is that it feeds the energy center, the mitochondria, to produce more energy and make the cells more viable and help them be more potent and regenerate. Our cells are dying as we speak. And with the NAD component, we're allowing ourselves to regenerate those cells and nourish them before they just shut down and stop working and we age even more.
Totally. And Dr. Brad, any any things you want to add to this or in relation to this?
Well, the issue is understanding the mitochondria and its function. Every cell in the body has mitochondria, and as we get older, the mitochondria shrink. Part of the aging process, our cells get smaller. Everybody knows as we get older, we shrink in size. Well, so do the mitochondria. This product line is going to help the mitochondria not shrink as quickly, and it'll also help the body rebuild some injured mitochondria. So mitochondria is the furnace that processes everything that comes in through a cell. So let's help it process it to its maximum.
Totally. And then also, one of the things that I understood from this product, which is amazing, is these are, talking more from a general point of view, they are not stem cell, but a stem cell derivative, right? So how's this? Can you talk a little bit about this point, Edwards, from a
Well, the cellular extracts and the peptide extracts are taken from the embryo of the sheep. The sheep are compatible with human beings. What they do is they extract certain sequences of amino acids into long chains. That those are the cellular extracts that help facilitate within the cell cellular communication. So the cells can communicate amongst themselves to better function. And with what we were talking about with Dr. Brad about the replication, that's the protein synthesis within the cell, which keeps progressing the cell and creating new cells as the old cells die. By helping that program be efficient, we have less mutations, leading to less degenerative disease. It's the preventative factor within the product, helping prevent disease through these cellular extracts.
which is amazing because I believe that you were telling me that you guys are the only company on the planet that have figured out the way on how to do that. Because there is obviously stem cell, there is place where you can get stem cell injection, but as a supplement or in a pill form, your company is the only one that was able to, or was the first one. I don't know if the only one, but for sure the first one to be able
people
to.
are catching up to us now, but yes, we were the innovators. We were the first ones to find a way to stabilize peptides and cellular extracts to function within the body, because they tend to be unstable. And this is above my pay grade. I'm not the scientist at BioCell, but from what I've been explained to and very thoroughly, and it loses me every time I get explained, but it's a form of electrophoresis they use, cellular electrophoresis, which is dividing the long chains, breaking them up, and producing the segments they need, and they know the cells need to flourish.
Wow, amazing. Now, one thing that I want to definitely, that I do know that I want to stress for anyone listening, why this is an important point is because this product, due to the innovations of the company, they were able to have it in a format that is, quote unquote, as a supplement. So therefore, anyone that is a practitioner, that is that they have a clinic or that they have a practice, they can provide it basically as a supplement, quote unquote, but they don't need to have all the requirement that somebody that does stem cell injection need to have. Is that correct?
Yes. Since we have all natural components, none of our components are medically, pharmaceutically based. They don't need to be prescribed. The company has taken the stance that we want qualified healthcare professionals, and that's why you guys train people to use the BioCell products and whatnot, to be able to explain the products to the patients and make sure that they benefit the most they can from it.
Exactly, which is, I think, is amazing. So, Dr. Brad, like a lot of people, like from all the data collections of all the people using this product, 84% saw a positive effect, right away, between the first and the second month. So looking more from a point of view of your self-use as a trainer, but also I know you using it yourself at your clinic, how these statistics and this proven record, how it's going to help a practice owners or wellness practitioners in terms of confidence and helping their patients to get a great result.
Well, in my experience, the single biggest thing most of patients or clients are looking for is symptom relief if they have a symptom, and more importantly to them, energy to get through the day. And we take care of mothers who are working jobs and taking care of children and being mom the taxi and having to function when they get home. So they run out of energy. And the biggest thing I've seen was this is the symptoms, yes, start to recede. Typically, normally, if we can get them to clean up their diet and take supplements from other products. But if they want to get more energy, that's the thing I've seen. They start getting energy within the first couple of weeks. They don't even have to wait 2 or 3 months for it to happen. And they love that aspect. And I've discovered the older the patient, the better they like it, because we older people run out of energy a little faster than you younger people. Fact of life. And so by taking them myself, it improves my energy, which means I can do a better job at work. I can do a better job in my clinic. I can do a better job at home. So you want to increase your energy. You want to help your patients increase their energy. I love this Ultracell product.
That's great.
Another
That's
thing
great.
I'd like to add, Danielle, to that point is post-COVID, we're getting a lot of feedback of brain fog issues out there.
Yeah.
This product is stellar on cognitive function stimulation. It helps sharpen the mind, and it helps a lot with those brain fogs and attention spans and whatnot. The cognitive aspects is one I benefit from I do it twice a year, and it's one that I find a benefit. I'm sharper and just more focused after doing a cycle of Human Ultracell.
Nice. That's definitely, absolutely, that's an important point.
Well, Edward, I'm glad you brought that up, because one of the biggest things I'm seeing clinically is we know that the COVID issue tended to hit the neurological tissue, but also the cardiovascular. And I've seen a nice improvement in cardiovascular function with patients on these programs.
That's awesome. Now, Dr. Brett, I'm going to ask you the next question. So, because I know that you have another Zoom live that you're going to do in a few minutes. So I'm sure that is a concern or a question that immediately goes to the mind of practitioners or wellness owner, clinic owner. They already have their own patients, and they already have existing patients that they are on a specific protocol, whatever that protocol is going to be. They are on a program. So from your point of view as a clinical director, how is this product that, by the way, that's how it look like for people who doesn't know. And we're going to talk more about this with Edwards, but how is this product not only is not going to be a problem for the existing protocol, but how does somebody fit this product with what already is happening with that client or with that patient?
Well, the easiest way to do it is just test it like any other product that we teach. And once they go on it, they start to love it. And the one thing I'm also seeing is once they start repairing, especially the mitochondria, their current program tends to start getting a little bit smaller, because the current program is handling some kind of a symptom or improving some kind of a function, where overall function is going to improve with it by strengthening the mitochondria. So the best thing I can tell a person to do is start using the product yourself. So you can personally see the benefits, start using it on your staff, and obviously start using it on those patients that have been with you for a long time that have kind of plateaued. So
absolutely,
kind of a no-brainer, easy peasy for guys like me that have been around forever.
That's right. That's great. That's great. Edward, so Dr. Brett, if you like to go I appreciate you being here with us. I know that you need to take off and you have the other Zoom meeting
I
to go
do
to.
so. So
Yes,
thank you very much, everyone. I hope to hear from you guys on the email line so I can answer your questions. And Edward, it's good to see you again.
Same here, Dr. Brad. Good to see you. Take care.
Thank you.
Thank you.
All right, so Edward, so let's continue this discussion. So this is for anyone that is not familiar with this product, that's how the product look like. So this is also there is a version here. I don't know if you can see it or not, but there is a version for men and a version for women. So can you comment a little bit on that, Edwards? Like why the distinctions and what's the difference between one and another?
One of the great aspects of this product is something that we're looking for in medicine today. You'll hear a lot of hormone therapies and whatnot. It's the hormonal balance the product provides, and the distinction between the male and the female one would be the cellular extracts from ovary for women and prostate for men, prostate and testes for men.
Sure.
And it'll be estrogen or testosterone specific for man or woman, and distinguish it to help balance hormonally either sex.
Great. There is a question from Margaret to say, does BioCell have a test kits? And yes, I can answer that question. Yes, BioCell does have a test kit. So you can reach out to Margaret. You can reach out to our health store, and we can help you with that. No problem. And anybody else also that if you have any questions, you're more welcome to send us your question live. That's why we have this podcast, and we love to be interactive. Edwards, another question here. So for anyone that is listening, either live or is going to watch this, so how easy is to implement this the protocol of this BioCell? I believe because here I don't know if you can see from the camera from the scene, it mentioned here say cycle 1, cycle 2, cycle 3, which and I know because I've used it myself and it's really plug and play. But can you explain like what this cycle 1, cycle 2, and cycle 3 means, and how does it work for normal patients or normal client that would like to use it?
The product was devised with dosing pre-dosed. So you'll get a 15-day supply within that box with 3 different cycles, 5 days of each cycle. It'll come with 6 pills each. And the first 5 days will be one formula. The second 5 days will be another formula. And the third 5 days will be a mix of both formulas. And typically what you do is every morning or evening, whatever the patient's preference is, he opens up one of the vials that comes pre-packed and consumes daily the contents of the vial. That's your daily dose. At the end of 15 days, we recommend you repeat it for 15 more days to get your 30-day treatment.
Great. So just as a clarification, so if somebody want to do for 30 days, so they do 1, 2, 3 with the first box, and then they take the second box to do 1, 2, 3, or
Correct.
they take 10 days cycle 1, 10 days cycle 2, and 10 days cycle 3.
The correct answer there is either one will work, because people were used to the former version that was a 30-day supply, and then it would be 10, 10, and 10. But since we're simplifying it with 15-day cycles to make it a little more affordable to the public, that way they can get it in 2 segments and whatnot, it's fine to do it the 5, 5, 5, 5, 5, 5.
Great.
As long as we get the 30 cycles in the person within 30 days continuously. That's the key here. We don't want any breaks, because once we break the medication, the concentration we have in the bloodstream and whatnot, and the benefits we're getting are tapered off because we didn't establish the continuity.
Understood. Yeah, that makes sense. That's understandable. One more question. So before we end off, I don't know if there is any more questions coming from the live people, but one key point. So from my understanding, so this sort of protocol, either the 15 days or the 30 days, is very much plug and play. So somebody, let's say, you get tested, they say, they do, let's say that the person is, he say, hey, I want to handle energy, I want to handle focus, and, I wanted to be more, have a bit foggy. Great, you're a candidate for this one. So they buy it and they just do either 15 days or 30 days. So that's kind of pretty easy plug and play. Is there anything else that a practitioner should know about it, or any things you recommend that from your point of view?
Look, we're in the supplement business. That's what we that's how I understand most of your practitioners take care of. And it's an industry where stuff's going to come out all the time. Don't look at Human Ultracell as another addition to your line of, look at it as the facilitator for what you're already doing to be more effective. The main thing Human Ultracell does is it facilitates everything you're doing within the body because it helps the body be at its optimal function to be able to remedy whatever needs to be remedied. So if you're on standard process or systemic formulas or something else, and you implement the Human Ultracell, you're just going to help all that be better and function in an environment more suited for it to work. And it'll also take secondary effects off. So sometimes you'll be like, the patient's progressing and he's doing better, and he'll be like, Doc, I mean, I'm feeling better and all that, but I'm still a little sluggish, or I don't have my concentration's a little off and all that. And like we've spoken about here today, the hormonal balance is something we all suffer at certain ages. We're all over 40, 50 years old. We're all suffering from that. And this will help with that cognitive function. It'll sharpen you and it'll give you that energy boost to take them over the top once you have them on track.
That's awesome. That's awesome. So basically, in a way, is across the board, I mean, something like this type of protocol is going to boost not only what you're already doing, if you're already on a program, but if you're not on a program, it's going to boost basically all your functions across the board.
Absolutely. I mean, there's a preventative approach to medicine too. That's why I take the product. I have the benefit. I'm blessed to be a healthy person, but I take it every 6 months. Why? Because I want to continue to be that way. And I'm aging. And as I age, my body's going to start to break down. But if I keep nourishing it with the cellular extracts and the NAD and everything it needs, I have a better chance of prolonging anything coming along degeneratively or any other pathology, hopefully. And that's why we're doing the preventive aspect of this as well.
Totally. That's great. Well, folks, you heard Edward, you heard Dr. Brad, and I hope we answered some questions. We brought some clarity, and also this was of value to you, and to looking into possibly implementing into your practice if you don't already do. And if you already have it, continue. In either way, if you have questions, you're welcome to reach to us. You can write to Dr. Brad at clinical@unsinc.info, or you can call our office. Otherwise, if you would like to be able to order it, you can definitely do so. We're dropping a link here. I think already the link is already there. So remember, there is a version for men and there is a version for women, and so that that definitely part of the game. We're here to help you, and also Edwards is always available, and he's if you have a specific question you would like to ask to him, he's obviously also is available to answer those questions as well. So Edwards, again, thank you for being with us, spending some time. It's always a pleasure. And for any one of you that watching live, appreciate it. Thank you for your time. I know that this is very valuable time that you spend with us, so I appreciate it. And for any of you that are watching this podcast, replay of it, and please like the video, and that was going to help us to spread the words if this is of value to you. And also subscribe to the channel. Like we always do new podcasts. We try to do it one every week, but definitely we always want to come up with the latest updates and news in the area of wellness and holistic arena. So anyway, thank you for being with us. Look forward to the next podcast. Bye.
Thank you.